So today's training video is talking about ice versus heat for TPLO or any other injury. I often get asked, what's the difference between ice and heat? The best practice is to apply ice on an acute injury or something that's new. An acute injury, such as TPLO surgery, involves tissue damage, inflammation from damaged blood vessels at the injury site. Acute injuries are short-term, and some common acute injuries obviously include TPLO, FHO, or any type of surgical procedure, as well as muscle or joint sprains, red or hot swollen body parts. Applying something cold, whether it be ice or even a bag of frozen vegetable, causes the blood vessels to constrict, reducing the swelling. So here's some tips for icing an injury. Like with any injury, it's important to respond as quickly as you can. You're always getting into something, aren't you? Mr. Sniffy Pants. The sooner the ice is applied to reduce inflammation, the more likely it is that the injury will heal quickly, because ice helps to constrict those blood vessels and reduce pain and inflammation. Be sure to limit icing sessions to 10 to 15 minutes for the next 24 to 48 hours. I recommend using a paper towel over the ice pack to help avoid irritation to the skin. So you take a little pack like this, frozen pack if it's a little dog, and if it's a larger dog you want to use a bigger ice pack. I find these rapid relief packs to be really cheap and really easy to use. So you take it out of the fridge, and what you're going to do is take some paper towel, and what I do is I just wrap it lightly, and let's say it's the dog's knee. So when you're applying it for the dog that's just had surgery, here's your knee, and you can just put it on the top side and just place it with your paper towel, obviously on underneath. The reason I don't put it underneath is because they've got a plate in there, and I find that the ice can make it get too cold and they don't like it. So I found that if you use a towel, something like this, it's a little too thick and it doesn't allow the skin to get cold enough. So what types of injuries should you apply heat to? In my humble opinion, heat is one of the most underutilized things for our dogs. Heat is used for chronic pain. I usually tell people to use moist heat therapy because moist heat gets deeper into the tissues. Because chronic pain indicates that the body is not fully healed and the pain recurs recurrently, what we want to do is help use heat to decrease pain and soreness. This is where moist heat a week after TPLO surgery can be beneficial. And this is because when they've had surgery, they've been jiggled around the knee, and I know that's a really technical term, but you get the point. So you can use it for post-surgery a week later, for stiff joints anytime, and especially great for arthritis. And heat therapy does the opposite that cold therapy does. Unlike cold therapy's ability to constrict the blood vessels, what heat does is allow the blood vessels to expand, so it allows for muscles to relax. And one of the reasons that the muscles get constricted following surgery a week later is because the muscles are there to guard the area, so to speak, and this is not a scientific terminology, but that's what it does. And so the muscles get all tight. So if we add the moist heat, it actually gets the muscles to relax and the tissues to relax and increases the tissue elasticity, allowing for circulation. So how do you do moist heat? It's super easy. So again, you take your gel pack, even if it's been in the fridge. I have ones that are not in the fridge, and I have ones that stay in the fridge, or the freezer. But what you do is you can heat this up in the microwave, or if you don't have a microwave, use boiling water. And what I tell owners to do is to test it on the inside of your wrist. So if you take this part of the wrist and you put the ice pack on your wrist, if it scalds you, it's too hot. So that's the temperature you want to use on your dog. And what you're going to do is take a towel. I like a hand towel, and you wet it, and it doesn't need to be put in hot water, and I just wring it out so it's not dripping all over the place. And then you wrap said gel pack. And in this case, you can actually, and again, you don't want to do this following a TPLO or any other surgery until about a week after, knowing that the tissue is not hot anymore to the touch. And basically what you're going to do is put it on both sides and just wrap it underneath. The nice part about this is that generally speaking, the dogs tolerate it really well, and you can just leave it there and they won't move. Or you can put it on the muscles above the knee to kind of relax everything. This is just such a great technique. And the reason you're using moist heat is because it gets deeper into the tissues. So finally, I know you're going to ask, well, how do I know if it's hot or cold, the area that I want to treat? Well, what I do is I have owners use the back of their hand. And the reason is that we're so used to touching things with this part of our hand that it just doesn't have the sensitivity that the backside has. So with your dog with TPLO, you can just put it here. I don't have treats, sorry. You put it here and then you can feel, if he was sitting the other way, I would just feel another joint and feel what's normal. And if it feels hot to the touch, then you probably want to use ice for a little bit longer. And very last, just remember, with either heat or cold, it should not be left on the skin for extended periods. 10 to 15 minutes several times a day works well. And if you want to learn more tips and tricks following TPLO surgery, click on the video above.